both for the private sector and for us as a government. We have difficulties on decision. How much we should pay them, the managerial fee, how much do we pay them? How do we monitor them? As we are going along, then we are learning. So, thank you. Let's put together our hands for him. Thank you very much. Dr. Manajan has taken the lion's share of this morning's discussion, intentionally because he's the host for the outsourcing program. I would like to welcome our brother, Mr. Emmanuel Mushamba, who is our expert in the private-public sector partnerships. We would like in the next 7.5 minutes or less for him to tell us his best about PPP, but at the same time give us a perspective of what is happening around the region, around the world, and give us an understanding of what could have driven Zanzibar as a case to begin with this approach. Mr. Emmanuel, karibu sana.
Asante sana. Good morning, everyone. As has been introduced, I work as a commissioner for the PPP department in Zanzibar within the ministry responsible for investment. The time limit that I have been given 7 to 8 minutes. Then we need to open up for another discussion, maybe later, or arrange another discussion specifically for the PPP. Basically, to start on highlighting the PPP arrangement in Zanzibar, the PPP was established or introduced by the government in 1999. And since 1999, we didn't really achieve a concession agreement from that time, apart from one arrangement for operation at the management operation at the airport. And later on in 2014, the government made a decision to put up a policy. The PPP policy was established again in 2014, and then in 2015 we enacted a new legislation to cater for the PPP arrangement in Zanzibar, followed by regulation in 2017. That is the reform which was conducted through the legal perspective. And for this high-level discussion today, I'll be discussing up to the policy arrangement. Basically, before I go on discussing the policy arrangement and the PPP allowance or concession, basically we say we define the government. If we define the government through this arrangement, then it is very easy to understand the PPP arrangement. The government we define for the whole sector through the policy. If you read through the policy, as I said, the policy of Zanzibar, not like in many African countries. Most of the African countries, the policies emphasize on the infrastructures provision that they have to deliver an asset either through the BOT or building transfer or cooperative or different arrangements in the PPP are there. But if you look at the policy of Tanzania and specifically the policy of Zanzibar, it actually emphasizes on efficiency, equity, access in such a way that it doesn't. It gives the provision of the infrastructure, but also it emphasizes on the access for the people to access health services, for the people to get equity on their provision of the health services, whether they are in the urban area or in the suburb area. So this is the advantage that the PPP policy in Tanzania or specifically in Zanzibar has. But also the PPP policy of Zanzibar, which recognizes that in some instances the private sector may not get returns directly from the people. No, basically in the PPP arrangement, we have 3 arrangements where the private sector can get back their money. One is through user pays. The user, they pay direct to the private sector when they get the services or they use the infrastructure. But another arrangement, it is the government pays. The government pays direct to the private sector. But in the other arrangement, it is it's a mix of the two, where the users, they pay for the services, but also the government pays. I see the moderators getting close to me, meaning it is an alert. But basically, on the success side, as we say, for the case of Zanzibar, we have, as Dr. have highlighted, that is what we have demonstrated to be in the PPP arrangement in Zanzibar. And in that arrangement, it depends. The PPP arrangement, they started from informal. We have those informal arrangements, as I said, where the private sector provides an infrastructure or provide their services. But we also form arrangements at which we enter into agreements, as Dr. have highlighted. But we also have an advanced stage of which we have the structured PPP arrangement. So basically, for the case of Zanzibar, we have this arrangement, and I can say we are now at we are not yet at the structure. That's why the doctor is saying we are experiencing some challenges.
Thank you very much, Dr. Manuel. I think I'm being timed by time. Unfortunately, the time is my answer here. I would like to welcome Dr. Muntaza to talk about it in terms of the current status of implementation, to look at the aspects, how they are monitoring their process of implementation, and finally, to discuss with us an overview of the strategies that they have put in place to make this process work. Daktari, karibu sana.
Thank you so much, Dr. Kabole. My name is Murtaza. I've been previously introduced. I am a family physician by profession and also the operations director for Safety Hospital Zanzibar, which manages the 10 district hospitals, 7 in Unguja and 3 in Pemba. So maybe everyone would ask, why was Safety given this job or given this opportunity to be one of the first pioneers in such a special project, which is a novel project for Africa in general, and a healthcare public-private partnership is being unheard of prior to this. So one of the mottos of Safety Hospital Tanzania is transforming lives for a healthier tomorrow. And we saw this as an opportunity to directly impact the lives of the people, which is the majority of the people who access healthcare through the local system. And being on the ground zero when this thing takes off gives us an opportunity to implement the small things that public sector might overlook. For example, customer care, right? Going to a hospital is like a journey for a patient. You go through the OPD or the emergency or whatever point of entry that you use, but you want to feel safe once you enter into the hospital. So this was the first thing that we thought about. How can we make this a safe journey for the patient, and in turn, it's going to work in our favor in having a public-private partnership with the Ministry of Health to improve the lives of the people of Zanzibar. So, in terms of operations, so we have been given 2 kinds of operations. We are dealing with clinical operations and non-clinical operations. In terms of our clinical operations, we are mainly handling the pharmaceutical services, for which I can say that we have almost nearly 100% availability of essential medicine and medical supplies. We have less than 1% out of stock in our hospitals for essential medication. And we are able to do HR management of the pharmaceutical staff to a level in which we can appraise them, we can appreciate their efforts, and also we can plan accordingly to have cost-effective measures in terms of human resources for the Ministry of Health. The second thing that we have been tasked by the Ministry is to oversee management for the two outsourced companies, which is the laboratory services and the radiology services for the hospitals that are being run by us. So what we do is we make sure that the contractual obligations that these companies have with the Ministry of Health are overseen, implemented, and the standard of health and the quality of service is right up there, where we can actually make sure that, because if they fail, we fail as managers. So we make sure that we oversee these companies to a level in which we can have a successful project. The other thing is some specialized services that we provide. For example, training and capacity building. So majority of the employees, they are very fresh, who need to be trained so that you can offer some specialized services. For example, theaters, ICUs, neonatal ICUs. So for you to be able to operate these hospitals and these specialized services safely, it was paramount that we train these individuals. So we found a way, which is a really unique way to train them. We decided that we would do medical camps every month, and these medical camps would not only focus on helping the people of Zanzibar doing the various surgeries, but it would focus on capacity building of these staff who are actually going to participate in these medical camps, which so far seems to be turning out to be a good approach, because we have been able to open the theaters in all the 10 district hospitals. We have already opened our ICU at GTMI Hospital, which is a bit rudimentary yet, but we are planning to progress and further improve the services. When it comes to non-clinical management, my colleague Dr. Marajani has talked like the lion's share of it already. So I'm not going to go into the nitty-gritties of it, but the services that have been outsourced in the non-clinical part is basically the auxiliary or ancillary services that are part of the hospital. For example, cleaning services, catering services, receptionist service. Like receptionist service was unheard of before. Like for a government hospital to actually have a dedicated receptionist service is a novel idea in terms of the healthcare sector in Zanzibar. So this is something that the private sector has been able to implement, and which has overall improved the patient satisfaction. So from our previous survey for the past 3 months, we have noticed that we have a patient satisfaction rate of 80% in terms of just the way they are welcomed into the hospital, the food that they are given when they're in the hospital. Recently there was a diarrheal outbreak, which we also provided special diets, and we were able to help many people and save a lot of lives. So this was highly appreciated, not only by the Ministry of Health, but also by the people of Zanzibar. So challenges are, nothing is without challenges. And Dr. Marajani has highlighted some of the challenges. For example, the challenge of HR shortages. So Zanzibar, it does lack skilled labor, and that is where the private sector can be paramount. Because what we can do is we can actually bring in the skilled labor, which will capacity build the juniors, and at the same time the ministry will have an opportunity to train their staff so that they can reach to the capacity that is required. When I look at my last part that Dr. Kabole had asked me to speak about, was what makes a successful outsourcing service in a hospital. Like, this is something that when I would go back retrospectively, I would want to have looked into this in a better way. So the first thing is clear contractual obligations. Like when you're coming into agreement with whether it's private or public or private, you need to have clear contractual obligations. Like for example, what are the KPIs from the board in? Like these are my KPIs, these are the services I need to deliver, this is the level at which I need to deliver these services. And additionally also flexibility. Because a contract can go on for the duration of 10 years, but are we looking into market inflation rates? Are we looking into the cost of maybe healthcare, the cost of services that are needed in the hospital? Are we looking into additional components that we need to implement later on as we are progressing through the contract? The other thing that Dr. Marjano touched about is monitoring and evaluation. And the ministry has rightly developed committees which are responsible to verify what we are doing. So we have the one that looks at the laboratory and radiology, we have one that looks at the medication and supply, and one that looks at management overall, which also helps us work together with them and improve our health services, because at the end of the day we want to provide excellence. The last thing is in a public-private partnership, what is paramount is financial gain. Now this financial gain, it's not only for the private sector. The private sector, as my friend Mr. Emmanuel said, most of the time it's return on investment for the private sector. But it's not always the case. It's also what values drive the private sector. For example, if what drives us is to also have social improvement, if we want to increase the level of healthcare, we want to actually do good for the people, that is a good motive to have a partner like Seifi, to be in this kind of a partnership where you know that the motive is not always going to be a quick return on investment. Because what the government needs to do, and I think that is their aim at what they are doing with the current situation of public-private partnership, is that they want to focus their finances on important sections of where it is needed in the community. For example, if Seifi can manage pharmaceutical services, Lancet can manage the laboratory, NSK can manage the radiology, then you are already saving the cost to that, whatever was being lost. And that can be used to better the services. For example, Zanzibar does not have a cardiac laboratory, a cath lab. Zanzibar does not, if you get an MI in Zanzibar, it's a problem for you. You can't get a cath lab or you can't get urgent services readily available. So I think that is the eventual aim, like to focus your resources on areas where you can do more and let the private sector handle things that they are already good at and they are already performing in the private sector. I think I would like to stop there. Thank you, Dr. Kabul.
Okay. Thank you very much. The discussion will continue outside this hall. This is just opening our minds to what is happening in Zanzibar. A lot has been discussed why His Excellency Dr. Hussein Mwinyi decided with his government to go this direction. Our development partners have been quite looking around and asking questions, why now, why is this? This session in a way addresses one of the reasons, but I can assure you, so far, so good. Despite some of the challenges that we are going through as government, the return on investment as a nation, we see it and we hope to improve. As Dr. Marijan put it clearly, we need to be better in developing the contracting process for issues around outsourcing. We need to sharpen our indicators and we must meet at a certain point. Emmanuel said, the private sector is return on investment, the government is the quality, equity and stability of the services. We must meet at a 0 point, so that we don't make the private sector bankrupt, but at the same time we don't make the cost of service unbearable for the government. The other issue that I can see that has come out clearly is we've been able to mobilize extra capacity as a government, extra capital to invest, and actually, if you go to any of our hospitals now in Zanzibar, we are not short of drugs at all. And one of the best things the president is being praised about, he feeds his patients very well, actually. Probably more than some of the places where he feeds them very well. Everybody who is prescribed the drug gets it. And we are now on the move to provide services beyond Zanzibar. Zanzibar being the hub, the center of excellence for services for our tourists, for people from mainland and other places. Because with a population of 1.8 million, we can manage ourselves and also offer the rest of our brothers elsewhere. So ladies and gentlemen, I want to open up this discussion for the next few minutes, but I want to recognize the presence of the Minister of Health. I can see the front desk, that side, Dr. Fatima. I can see the Director of ZFDA, the Chief Pharmacist is here. I also see my colleague from the President's Office, my brother John Mahundi. You're most welcome. Ladies and gentlemen, all the development partners, karibuni sana. Anybody with a burning session or contribution, karibuni sana.
Thank you very much. My name is Ahmed Mahfoud Mohammed, and I'm a consultant of nutrition gynecologist recruited by HIPS. There is a memorandum of understanding with the Ministry of Health, and I am responsible for all the job training, mentorship, capacity building of the doctors in these hospitals. So I report hospitals. Seven in Zanzibar and 3 in Pemba. So I'm talking from my personal experience. As what Dr. Marjani has said, I've been thinking all the time these challenges. A lot of that they are new. The MOS is new to this, and the SAT also are new to this. So my question is, why all the hospitals have been outsourced? Why not do a pilot project first and learn from it? But we have jumped to all of them. So I don't know, this is why we have overlooked to do some pilot project of the hospitals and then learn from that, and then we spread out. But we have jumped all of a sudden, so this surprised me. That is the question for Dr. Marjani. Now for Dr. Mashimba, it seems this PPP has started from 1999, going on up to now, and there is you acknowledge that there is a failure of the equilibrium between the two. It is lopsided. So the services, because if it is outsourced, whether it is private, whether it is local, for us, we are in the stage that it must be service-oriented. And this can't be service-oriented because we have the profit investment from the private sector. So this equilibrium has not been achieved up to now. So what sustains us? Why should we go on like that? And for Dr. Moses, I should say that I visited that place. The treatments the problem is the human resources. It's true. We are talking about the clinical service like pharmacy. The drugs are there. But my experience, the drugs are there, but they are not accessible when they are needed. For For example, in Lebanon, I stay in Lebanon, and they need a misoprostol. They need this drug or the other drug for management of PPH. They have to request to go to the pharmacy and get. So this accessibility, timely accessibility is a big problem. And a place like Lebanon, you have postpartum families. You cannot waste time. Delay the accessibility of some of the drugs that they have to make requests. They will delay, but this delay contributes to death. When it is needed, it is there, but when it is urgently required, this problem can actually contribution. Another point you mentioned about the capacity building. That you accept before the health specialists will maybe buy where they come from, then they organize a camp. Now, usually they will invite you, arrange patients for biomectomy, for whatever these fantastic surgeries. They do the surgery, they go away. That is tourist approach. There's no capacity building there. From my experience, capacity building, you should sit there, be part of the system, be part of those doctors in there, and should be on the job training. Problem-based learning. It is not a question of organizing a camp and how they bring medicine, they bring surgery, they do those surgery, they go away. That is not capacity. Sorry if I have been very critical. Thanks.
We have enough questions from the audience, so my learned colleague. So I just want Dr. Marijani to go through it and then we'll wrap up this session. Thank you.
Thank you, Dr. Ibrahim. Dr. Hamid, thank you so much for the comments. You are very right. The right way should have been studying the pilot. Probably one hospital or two, one in Unguja, one in Pemba. But when I started, I said we had challenges, pressing challenges, like 5. So time was against us. But the way you proposed it is a very good idea, but it needs time, lots of time, and the time is what we didn't have. Unfortunately, or fortunately, at the same time when the new hospitals were being opened, we were addressing the issue of health finances. We have a shortage of finances for health. So we were introducing, we have established the Zanzibar Health Service Fund, insurance, health insurance for that. And then we said, with the human resource, with the type of the human resource that we have, probably we will not be able to capture much funds from the Zanzibar Health Service Fund. But the digital health system, again, I said, we had a problem. We are paper-based. How do we move that? So we said, no, the private sector will help us. Both digital health, the Zanzibar Health Service Fund, and other things. We are not good in cleanliness. We are afraid the 10 new buildings of the district hospital will be in shambles within 1 year. We weren't so sure. We thought we could do better in the private sector. And yes, we are doing better. Slowly, we are learning. The pilot would have taken time. Thank you. Thank you very much, Dr.
Thank you so much for your objective and critical insights. I would like to answer your questions in the first question about the emergency medication needed for maternity or obstetrical emergencies that happen in the emergency and the labor ward. So we did see this challenge in the beginning, and we have implemented kits. So in every neighborhood and every emergency room, we have kits for PPH and for eclampsia. So there is a form inside. Once they use it, they just fill it up, go and get a new kit. And I will look into it as to which hospital you are talking about after the forum. And we can see exactly where we are going wrong in terms of provision of these medications. But the system is in place and the kits are there, so it's just a matter of seeing if it's being used in the right way. In terms of human resource, there was an initial deficiency in the number of human resource, and then also in the skill level. And the other unfortunate problem is that everything in the government has to work with the budget. So we have to get a budget approved for human resource training, especially for these special skills. For example, advanced cardiac life support, BLS, neonatal support, right? People who are going to be trained in ICU monitoring, emergency care. So this thing is going to take a process, and we sat with the ministry and we said that we would organize these camps not as a tourist approach, because these camps are not organized by companies outside Seifi. Seifi Hospital Dar es Salaam organizes this camp, and we have our doctors on site. We follow up these patients until recovery, and we take care of any complications post-camp. So we have had instances where we have sent patients all the way to Nazimoja, followed them up and got them treated. We have had patients who, because of delay in care, we had to refer them to Dar es Salaam as well. So we are working on it. Thank you.
Thank you for the opportunity again. Thank you, Dr. for the insight. But basically, it is your concern on the timing and how long it has taken us from the first 1999 Concession Act. Again, we went up to asking the private sector to partner with us in 2014 and 2015 with the new act and the new policy. And the rationale is, as I said, PPP are arranging part of the financing arrangement. For us, we are actually looking for innovation and technology. We are looking for innovation and technology. Because you can hear what Dr. Marijani is saying, and I just came from Pemba, and yesterday we were actually in a handover between the private sector and the public for the port. Because PPP, we believe they bring in efficiency. Now, the urgency of stopping doing business as usual, it is now. And sometimes, for the government, we are actually trying, like any other government, we are trying with three things. When we are doing the act, are willing, ready, and willing and able. Those are three words: ready, willing, and able. Now, if you look at the 8 governments of Zanzibar and President, we are ready, and we are willing, and we are able. That's where we have started. And thank you very much.
Ladies and gentlemen, I want to thank you very well, but also appreciate Dr. Hamid's questions, which takes me to the request to the Minister of Health. All of you are here. We need a special session for this contracting process in our time. This war and this time is not enough for us. But I want to assure you, Dr. Hamid, we don't have time to try things. Our people are dying. There's no time. We are sure that through this process, we shall get there. We are going to learn, and we are learning a lot, and we are learning fast. And what we are going through right now is rolling learning and moving. Supposing we piloted 2 hospitals and they did well, and then others are not doing well, that would be a disaster for the government. So as a government, we have a short time and space, and we have to do this. So I want to thank our audience so much for being very kind listeners, but at the same time, apologize for not giving the opportunity to ask questions. But I assure you that the ministry will arrange a session for you specifically, because it seems this is a very interesting session. Thank you very much. We'll meet next time. Thank you very much.